Excuse me. Wow.
Do you hear that?
Yeah, actually, that's not me.
Who's coughing?
I'm not sure, but we should help them with that.
Oh my gosh. Are we going to talk about... Stop coughing. Sometimes you can't stop coughing.
Yeah, exactly. Sometimes it's a bronchospasm, and we'll talk about that today too.
This is the Be Well Now podcast, and man, we're talking about like bronchial infections today, how to treat them naturally. So
yeah,
what is a bronchial infection? Like, give me a more colloquial name for that.
Well, I like to describe to people the bronchioles, the lungs, essentially as an upside down tree, and your trachea in your neck being essentially the root system, or the trunk is probably better described, of the tree. And essentially the leaves and the branches are what our lungs look like. So if you took an x-ray and you see all of these little lucencies and these little channels, that's essentially is your lungs. Now those little cavities need to have moisture in them. They need to be vascularized as well. And they play an important role in the exchange of oxygen and carbon dioxide in the body. And so if we get an infection, either by inhaling, say we get dirt or a pathogen, some sort of pathogenic factor into our lungs by inhaling it, it can get lodged in one of those areas and not be cleared out, and then it can become infected.
And so what is a more common name for a bronchial infection that we might know?
Yeah, so most people will experience things such as flu or bronchitis, pneumonia, even COVID. We know that there's a lot of lung effects with COVID as well. And
those are just miserable.
Yeah, they're horrible things. People don't want to experience them. And if they're experiencing it, they're usually down and out.
Oh, it's just, and you'll do anything at that point if you get sick. So we want to talk about what folks can do maybe naturally to relieve some of this. Because I don't know, sometimes you just end up taking antibiotics, which if you're listening to this podcast is probably the last option in your preferred arsenal.
Sure. Well, some of the things that people can do is, first of all, if you have an infection, you'll generally have some sort of consolidation that takes place in the lung. If we think of an infection anywhere else in the body, we usually look at redness or some sort of pus or swelling, right? Well, having that occur in the lung is not necessarily any different. And so we want to begin the process of maybe breaking down that consolidation. So we can do that through even introducing steam or hot water, right? So taking a steam bath or a hot shower and breathing that steam in. And I like to include in that certain essential oils like melaleuca or peppermint that are very aromatic. And you can breathe them deep into those bronchial trees as well.
So could I get like a pot of boiling water like my mom used to do and like put a towel over it?
Yep,
and then
over
put
the
some
stove.
Essential oils in there, or
Yep.
even after it's off the stove, it's still steaming,
yes,
or whatever. So you could do
well,
it that
but
way.
heating it up, I guess, was the idea that I was. Don't lean over the stove and then burn your
Exactly.
clothes. Sure.
So that's an option. And then you could probably just drop the essential oil
directly into the water.
Into the shower, though, as well?
Yeah,
like
in the
on
shower. So I just drop it on the floor sometimes in the
Right.
morning. If I'm feeling a little bit of a respiratory-related issue, I'll drop it on the floor of the shower. And if it's steaming and hot, then it'll just steam right up, and you'll have a nice steam bath, I guess, or steam shower.
So that's peppermint. What were the other ones?
Melaleuca or like tea tree oil is really good. And even though sometimes I'll use clove, but those are probably the best for the lungs as far as essential oils. Another thing that you can do that I really like to use is ozone. You can utilize ozone. Now, people will look at that, at what I'm saying, and they'll probably go, oh, you shouldn't use ozone. You shouldn't inhale that into your lungs. And that's true. You shouldn't. You shouldn't ever inhale ozone directly into your lungs if you can avoid it. Ozone essentially is 3 oxygen molecules bound together. It's the same smell that we get when we have a lightning storm. That compression of oxygen that occurs as a result of that lightning is called ozone. It's also a layer in the atmosphere. As we get up higher away from the Earth, we have an ozone layer. Well, ozone has a mechanism that it will break down bacterial cell walls, and it will also unravel viruses. So it has a very, you could say, antibiotic type of effect and even antiviral effect in the body. So the way we introduce it to the lungs is we pass the ozone through oil, like olive oil, and it will bind to the carbon molecules of the olive oil, and then that allows it to not irritate the lungs, the lining of the lungs. And so by doing that, we're able to introduce the ozone into the lungs. And that's another way that we can, if someone's having bronchitis or more like a pneumonia in that case, we can introduce the ozone and help to begin to clear out the infection.
What about like Vicks vapor rub type of products? Not to name
topical
any brands.
rubs. So yeah.
So people are going to know about those. Whether you'd recommend them, I'm dubious. But
these are great options to use at home, sure. And I think a lot of what Vicks provides topically is the menthol that you breathe. And so that breathing, the aromaticity of the menthol is really what people are getting. And it's helping to calm the lungs down so that they're not spasming as much or initiating that cough and that contraction as much as they would otherwise.
So what about the effect of it being on your skin? Like, is that doing anything, or is it more of it's there for you to breathe in? And
I think it's really more aromatic. From the ingredients that I have evaluated and looked at it in the Vicks Vapor Rub,
right?
I really think it's more aromatic than it is like penetrating directly through and affecting the lungs themselves.
Okay. And so the ozone's obviously something that you would provide a natural health practitioner. I don't know.
Yeah, that wouldn't necessarily be something someone would be doing at home. That would be something we would do here. But yeah, the bath, the shower, the essential oils, those are all things people can do at home. Also, doing a lemon, ginger, and honey tea is very beneficial. And putting a little bit, maybe a little extra ginger or even some cayenne pepper with that, that can help dilate the vessels and the bronchioles.
Because they'd be, inflamed otherwise, and you want them less inflamed?
Dilate is opening. We want them to be open so that you can breathe.
Okay.
Yeah, so you're not having the constriction or the bronchospasm, yeah.
Cool. I don't know what you're talking about. I just enjoy hearing it.
Yeah, no problem at all. That's good. A lot of people out there probably had the same question.
So what do I do with the ginger then? I have lemon, okay. I've got lemon. I've got my local natural honey. Yeah,
and I like to use fresh ginger. And I measure it with my thumb, cut off about the size of my thumb from the knuckle, that last knuckle to the end. And then I'll slice that up and put it in there into a pot of water. And depending on how much you want, I usually will plan on having about 2 cups myself. And then I would just taste it as you're making it. But the lemon, ginger, and honey mixture has been a common household remedy for a very, very long time. And it's something that it stimulates the liver, and the liver plays a significant role in immunoglobulin formation, and that helps with our immune response. It also helps with our urinary tract or the elimination. So you're thinking of if we do have some sort of pathogen or some sort of bacterial infection, we need to be clearing that as quickly and efficiently as possible. Well, through the digestive tract, that's the liver and the gallbladder, and through our urinary tract, well, that's the kidney and the ureter.
Do I boil the water and then put the ginger in, or do I I like the basic, just tell me what to do stuff.
Yeah, I would bring the water to a simmer. I take 2 lemons. I actually take a lemon, cut it in half, and then I squeeze out the contents of the lemon. If you don't have that, you use lemon juice, right? And I would say it's not as good of an option, but it's a good option also. But I use a whole lemon that I'll squeeze in, and then I'll use probably about a quarter of a teaspoon of ginger. And then with the honey, I put honey in it until I'm satisfied.
But do you put the lemon in at the end or as it's simmering.
As I just put it in, I'll put the water in, and then I'll just add all the contents. I don't get super scientific about it, and I like how you are.
Because if you make me feel like it's going to be good for me, it'll probably be better for me, right?
Yeah.
The mind works that way.
Yeah, there is something called the placebo effect, you could say, right? That if you believe that it's going to work or have a specific effect, it may.
I'm just saying that if you give me the exact directions on how to make this tea, then I'm going to go home and make it, and I'm going to feel like I got a chance.
Yeah.
know?
So put the water in the pot, put it on the stove. Okay. Put your ginger in, put your honey in, put your lemon in.
Sometimes I'm like a very smart adult, and sometimes
I think you're super smart today because obviously I need more detail in my explanation of my recipes.
I don't think most people do. I just like the instructions. I'm an instruction follower and a rebel at the same time. Anyway, so you've given us a few options: ozone, lemon ginger tea, essential oils, or steam.
Yeah.
What else?
Well, here's let me prelude this with a story about one of our patients that came in recently. He's 4 years old. His mom brought him in because he was having, she said, basically since he was born, he'd been having repeated attacks of bronchospasms, chronic upper respiratory infections, and respiratory lung infections as well. And it would just trade on and off. And she was out of her mind. She was just really frustrated. She was at her rope's end or wit's end, right? And she was looking for options. She'd been given inhaler after inhaler. She'd been given bronchodilator. She'd been given all sorts of things to try to help this kid. And he was still having these bronchospasms repeatedly, and they were unremitting. So we look at that and say, wow, this is someone who basically was trying to employ every tool in the arsenal of the modern medicine toolkit. And it wasn't satisfactory. Let's put it that way. And this poor kid, the mom went repeatedly where she had to take him to urgent care. She had to take him to the ER and then urgent care. And she was done with it. And she said, look, here we are. We don't know. People have been recommending you. And so I just wanted to see if there's anything that you could do for him. Maybe not. I don't know. I'm just here. So we decided to do a few things in the course of treatment for him. And I'll talk about probably 3 things at this point that we haven't discussed yet. But one of those is infrared. Doing infrared, the infrared light, that spectrum, will penetrate through the skin and can help even go through the lungs. And that infrared can activate cellular regeneration and tissue regeneration and healing. It will go through the cell and activate the mitochondria. The mitochondria, if a cell is functioning adequately and ideally, it can repel infection. It can resist infection. And it can even function to alert, say, the immune system to a potential infection. Okay? So we ramp up essentially the body's mechanism by sending a red light frequency through the lungs of a 4-year-old. Okay. This boy had not slept when he came to me. She said he has not slept a night in 2 weeks because he's just been coughing. And you can imagine, poor mother pulling her hair out. And she'd already been to multiple visits in this previous 2 weeks as well. So we put the infrared light on. And on a 4-year-old, I explained to him we were going to do some acupuncture. We were going to put some needles in his hands, in his feet, around his lungs, his chest cavity, the wall. And also, the last thing I told him we were going to do was have him take a specific tea, a combination of herbals that we were going to give him and send him home with that he would take every day. And he agreed to that. Now, after I put the light over his chest, put the needles in, and turned down the lights, and I walked out of the room, and I said, okay, I'll come back in about 8 to 10 minutes and just check on him. I went back in the room, and this little 4-year-old boy was passed out asleep, was just asleep, his arms draped over the bed, and you could hear him kind of snoring a little, right? A a little bit congested still, but he was snoring, and Mom was over there crying. And she just was like, I haven't seen him sleep like this in weeks. And so you can imagine the impact that had on her life. And it reminded me of the time when I had my son and he slipped and fell and injured his hip. And I've shared this story before, I think, on this podcast. But my son ran out of the kitchen. He was 2 years old. He had been walking for quite a while at that time. He slipped and fell and injured his hip. And he wouldn't walk anymore. Again, for a week or two, we were trying to get him to walk, and he just wouldn't. He would lip and go back to crawling. We eventually took him to a chiropractor. He held him, assessed him, pushed on his back. I heard a click. He set him down, and he runs over to my wife without any issue. And I was like, whoa, we've been trying to do that for weeks, right? And so it felt an honor to be able to work with this young 4-year-old and to employ strategies after many strategies had already been employed, and to have a level of success that had not been achieved.
What was that like for a 4-year-old? Have you ever put needles in a 4-year-old for acupuncture before?
Yeah. Oh, yeah. Well,
and they'll take it.
And I have kids. I have 6 kids. So
you've done that on them?
Yeah, I've put needles on infants and 4-year-olds, 2-year-olds, 1-year-olds.
Whoa.
Certainly when kids come into the office, it's not a standard thing for me to say, okay, we're going to do needles on a toddler. Most often because I think within our culture, there's a phobia of needles in general. And so introducing another needle to a kid is usually not the greatest idea at the beginning, right? Until you've developed a good relationship. But he was 4, and I felt it was an important piece of his treatment. I explained it to his mom, asked if she was okay with it. Some kids are not. Sometimes parents will come in and I'll talk about needles, the potential needles could offer, acupuncture, and she'll just say, no, Mom or Dad, like, no, needles are no-go. We have to figure something else out. And that's just what you have to do. You have to strategize, and then you have to say, okay, well, let's figure out what else we have in our arsenal. And so in that case, I just mentioned 3 things. So infrared, acupuncture obviously being thousands of year history in treating basically primary care conditions, which is what we did in that case, and having a level of success that has kept it one of the leading treatments and therapies worldwide.
I think acupuncture is so fascinating because if people have never done it or have tried it a couple times, they have opinions on it. Mm-hmm. But having been here at your community acupuncture, this is the room where 5 people sit, and it's a much more budget-friendly option, and you can buy passes and get an even bigger discount. I just talk about that because I know people out there are curious. What does it cost to get acupuncture? I swear my body, like, now that I'm 50 acupuncture sessions in, like, it responds super well to it in a way that I could never define it before. I was like, it was relaxing. I don't know if it did anything, but I mean, I like it. I'm into that stuff.
Well, and that's usually where people start, right?
But you say it's a practice. Like I feel it now. I'm like, I can genuinely feel the beneficent effects most of the time. Mm-hmm. Sometimes it's just a nice relaxing thing, and I don't know if it did anything that day, but most of the time, and then sometimes it even hits me the next day where I'm like, yep, I'm feeling a lot better than I was before I came in. Yeah. How does it even work? It's a practice.
Yeah, so acupuncture is a practice. I like to say that, and it's so true. And it does have an effect in a singular implemented therapeutic approach, but it's usually, like you said, I'm not so sure from the person's standpoint, because they're often not even sure what they're looking for, or what it is that is going to be added in a beneficent way to their life. They're not sure. So what acupuncture does is it works on the autonomic nervous system. It works through your brain. And if you can tap into your brain, well, you can have an impact on anything, right? Because we know that neurology impacts every organ and of the body, right? It's stimulating the release of hormones. It's stimulating the release of endorphins, right? And it can even, let's say we have a scenario where we have a specific trigger. And when we are triggered, well, what happens to our autonomic nervous system? It becomes completely dysfunctional. We go into fight or flight mode and we're just in a panic. Okay, well, acupuncture can be a mechanism by which you can practice being in a balanced state so that when you approach or reach a trigger, you're not so set off by it. And therefore, your reactions are not instigated by this response, like I have to flee and run from the tiger. People would often say, I'm resisting calling it an emotional response because I think emotions are an important piece of what we're supposed to feel and know too. But let's call it an erratic response. And that's, I think, more descriptive properly of what happens when people find themselves in an autonomic nervous system dysfunctional state, is they make erratic, almost irrational type of decisions. And so if we want to bring the logic of our life back into bounds, then we practice something. We could practice Tai Chi. We could practice yoga. We could practice breathing, breath work. We've talked about that. All of those type of activities, acupuncture is at the foundation of all of them, stimulating directly our brain and our nervous system.
Very cool. So back to the treatments for bronchial infections.
Yeah. So another one that I like to recommend to people is, you want to stay hydrated, right? So make sure that you're drinking water, fluids, but also that the fluids that you're getting have electrolytes in them, so that you're not just drinking water only, but that you're getting minerals as well. Because a lot of people miss the boat when they think, I should be hydrated. I've had tons of water. I drink water all the time. And especially people, maybe they're doing reverse osmosis. They're pulling all of their minerals out of their water. Well, that's not complete or full hydration. When you go to an ER and you get a bag of fluids, they don't give you a bag of H2O. They give you a bag of minerals, right? It is water in a significant amount, but it's a specific solution of minerals that is matched to the tonicity of the blood. So when we put that fluid into the body, that's hydration, because it's with minerals, not just water on its own. And so proper hydration is important to the lungs, especially because when we have, in Chinese medicine, let me describe it this way. We have a condition, and this happens sometimes in the lungs too. We call it damp heat. Damp heat is an infection, okay? And dampness can occur when fluids congeal. And you have heat, and heat can dissipate fluids and even cause steam, you could say, in normal life. But that can happen in our body too, where we actually are running warm enough that we're dissipating the heat. And then certain fluids that are maybe somewhat resistant to rising and moving can congeal and become somewhat stagnant. Well, that stagnation, that congealing, is what we call damp heat, and it can become infectious. All right. So then how do we clear that? Staying hydrated is one of the best ways to clear that, making sure we have proper amounts of fluids, which should be half your body weight at least, in ounces of water every day with minerals. Okay. Another one I like to recommend is bone broth, or otherwise known. So bone broth I call is the modern word for chicken noodle soup.
So there is actually a benefit to chicken noodle.
Oh yeah, it's bone broth. Yeah, so if you just go get chicken noodle soup from a package and it doesn't have any, if you make it at home, you put the chicken in there. You're steaming this chicken, or you're a lot of people use a crock pot, or they'll use what are those, the pressure cookers, and in that way you can get the sustenance and the stem cells as well from the bone, from the marrow. Okay. So that level of amino acid, that's what we're wanting to get. That's the point and purpose of bone broth. And that's the point and the purpose of chicken noodle soup. It's not Campbell's in a can. It's literally the sustenance and benefit of chicken noodle soup is bone broth. And without it, well, I mean, you have some carrots and celery, you could say, and I don't know. I mean, I wouldn't really call the noodles much nutrition at all.
What about chicken stock? Does that have bone broth in it?
Chicken stock is essentially like bone broth too. Yeah. If it now, are you talking about the cube?
No, because I went to the natural grocers and I got rotisserie chicken from some major supermarket chain because I was too lazy to cook the chicken. But then I went and got the organic chicken stock or something. So am I going to get some of that
chicken stock you're going to have? Yeah.
Okay.
That's a good.
Just curious what
there are steps and stages to all of them, right? And I mean, obviously the best way to do bone broth is to have the bone itself or breaking the bone so that you can get some of that marrow to leach out into your broth, and then to pressure cook it or put it in a crock pot and leave it for hours, right, in the crock pot. And that's probably the best way. But yeah, another way of getting it, absolutely, getting a nice organic chicken stock or beef stock. They have too, a nice organic beef stock. That's bone broth.
Okay,
right?
so bone broth is a big deal in terms of respiratory infection.
Yeah, and then the last one that I would recommend to people, and you can add this, say, to the water when you're trying to do the steam bath or the steam shower, or like you mentioned, taking that pot and pulling it over, putting the cloth over your head and breathing that steam in. You can do some oils, but also you can put some salt in there. So salt's going to have minerals, especially if you use real salt, Redmond salt, Celtic sea salt, a good quality sea salt. It's going to have minerals in there as well, so that's beneficial. But salt itself resolves masses, and it resolves. So if we have congealed sticky fluid in tissue, like we talked about before, the damp heat, salt is going to help resolve that. And that's an infectious type state. It's going to help resolve it so it can clear it out and along, and it can be pushed into circulation. And if we can have fluids moving more efficiently and less stagnation, then it stands to reason we're going to have a lessened chance of developing an infection, or at least lessened chance as well of furthering an infection. So salt will help with that. You could do a gargling with salt, because sometimes people will feel it in the trachea, in the throat.
So for a sore throat, just the right kind of salt with a little warm water.
Yes, gargle. Exactly. And just gargle if you're starting to feel some of your infection, if it's crawling up into the throat, especially if you're noticing any coating on your tongue or in the back of your throat. I would do a gargle with salt, and possibly even I would add some apple cider vinegar. Throw in a capful of apple cider vinegar, or a eighth of a teaspoon of apple cider vinegar is probably more accurate, and that will help resolve your respiratory woes.
Just for the gargle session.
The gargle.
And warm water over cold, or hot?
I prefer warm. Whoa! Wow, that was like a tongue twister. I prefer warm water.
Okay. Some good options there. Good options there. And then you're in the middle of it. You're miserable. These are some ways to help, huh? Yeah.
And I think we've covered some pretty good strategies today.
So what did the kid go home with? Okay, he has the thing where it's church, and
so we talked about herbs.
The televangelist has made the person walk again. Okay, but what happens when they get home?
So we sent him home with a couple of things. I sent him home with an herbal formula. I had some specific herbs for his lungs that he was going to take every day. And then we also sent him home with some silver drops that he was going to drop into his nose. And that's what he did.
Colloidal silver, or what is that?
Yeah, it's similar to colloidal silver. It's a silver protein.
Okay.
It's called arginol. It's a silver protein. It's more potent than colloidal silver.
So I interrupted you.
So we sent him home with those, and he did that for several days. We had him come back for 3 more sessions. But by the second session, he was way better and not really having bronchospasms anymore. The interesting thing about this kid is that they were coming up to a surprise trip that the parents had planned. And this was also one of the things that was adding great anxiety for the mother. They were wanting to take the kids to Hawaii. And she did not know if this was even a smart idea or even possible with the state that he was in at that time. And it was making her really nervous because it was a super special thing that she and her husband had planned for them, and they wanted to be able to do it for them. And I told her I think that we would be able to get him ready to go on that trip. So it was about a week and a half that we had, and he went on the trip, and he did great. Now, I do think that some time in Hawaii and that moisture that you get, in Hawaii and swimming in the ocean. Again, think of all the salt. Think of all the things that we talked about, right? He's getting the sun on his lungs. He's getting it into his lungs. He's getting it onto his skin. He's swimming in the ocean, which is salt water. And his stress. I mean, 4-year-olds in stress. I guess there was less stress probably for him there too. So that was a helpful thing, but he was much better and definitely on his way before he went. When he came back, he was still doing well. His mom was amazed that he was even able to make it through the trip. And we treated him a few more times, and he's been doing great ever since.
If they want to learn more and consult with you, where can they find you, Doc?
So Community Health and Wellness in Heber City is the place to find us. You can find us online as well at the Be Well Now Podcast.
At gmail.com.
Okay, Be Well Now Podcast at gmail.com.
Or on Instagram, Be Well Now Podcast.
There you go. And then you can also find me on Instagram at Dr. Ron Dummar.
This was an episode.
I hope everyone has a great day.
Of Be Well Now.
Namaste.
Namaste.